so we're going to dive right in, and we're going to talk about the objectives of the presentation and then do some introductions for our speakers, and then we'll have at it. And so for starters, so for today, we're going to be talking about our professional standards and clinical expectations for supervision. And then we're going to give you a couple of models for you that you can integrate into your work as a supervisor when you're working with a supervisee that is culturally and racially different than you are. Our MSJCCs, which is our Multicultural and Social Justice Counseling Competencies. And then we're going to talk about the Multicultural Orientation Model of Supervision. We're going to integrate some cultural broaching, our ethical models, and also our ACEs best practices. But for starters, let's give you all a sense of our panel of presenters. My name is Dr. David Ford, and I am a second-year faculty member in the Department of Professional Counseling at Monmouth University on the beautiful Jersey Shore. And I have been in the profession since 2011. I've been practicing and providing supervision since then, and I've been teaching since 2014. And my experience in this area is that most of my supervisors have been racially different from me, and for the most part, my supervisees have been racially different and culturally different from me too. And because of my own personal identities and my experiences in supervision, I wanted to talk about my experiences, the good and the bad, and also give some best practices for mitigating those cultural differences and similarities in supervision so that a supervisee does have a rewarding supervisory experience. I'll turn it over to Dr. Sam Sanabria.
Hi, good afternoon, everyone. I'm Dr. Samuel Sanabria. I'm a faculty member at Rollins College, which is a small liberal arts college in Central Florida. I am a faculty in our graduate counseling program. And we have a very strong social justice, multicultural identity in our program that we're constantly working on. We're very proud of it as well. I do supervise our students during their clinical experience. And our students are predominantly white and female, working in Central Florida, which we have a lot of diversity. So they are working closely with diverse clients. And so in clinical supervision, our discussions always centers around the client's identity, as well as our student counselor's identity and how they are relating to each other and how prevalent that is to their experiences and to the relationship. And so what I hope to gain from today's experience, of course, is to further my understanding and expertise in this area. I'd love to hear from participants and what their experiences are and what they notice in their own practice and what they anticipate and what they're experiencing, so I can broaden my understanding as well. Thank you.
All right. Future Dr. Matthew Tirrell.
Hi, everyone. My name is Matthew Tirrell. I'm a licensed professional counselor and an approved clinical supervisor in the state of New Jersey. I'm also an administrator and an adjunct professor at the wonderful Monmouth University. So I have the privilege of working with Dr. Ford and Dr. Branch every day. And I'm currently working toward my doctoral degree, as Dr. Ford just mentioned. So I'm doing that at Montclair State University. I'm very glad to be doing that. So my interest in this topic really arises from my work in field placement and in my role as a supervisor and having taught field placement courses. So in those experiences, I've seen difficulties between supervisees and their clients, supervisors and their supervisees. And Monmouth University is predominantly white. Our program is, predominantly female and white as well. So that is not representative of our global community or even our local community. So we tend to see some issues arise. And my hope is to understand a little bit more from all of you, gain some insights into your personal experiences with the supervisor and supervisee relationship.
All right, last but not least, Dr. Jason Branch.
Hello, everyone. Thank you for joining us. I am Dr. Jason Branch. I'm also at Monmouth University in New Jersey, assistant professor. I've been in the counseling profession for about 15 years, counselor education for about 8 years, served as a supervisor for about 5 years. So a lot of clinical experiences and a lot of life experiences, which is what we're going to talk about a lot today. So a lot of these hands-on experiences that happen, a lot of hurdles that I've overcome, and hopefully the hurdles that I've overcome will help you not overcome those same hurdles. So kind of helping you process serving as a supervisor or being a supervisee and working with clients. I'm really looking forward to the opportunity. So thank you all for being here. Looking forward to getting started.
All right, and so as we're talking, if you all will, in the chat box, kind of give us a feel for where you are, and what you expect to gain from our time together today too, so we can integrate those things into our presentation. All right.
So I'm going to go ahead and kick off the conversation with ethics. I feel like all conversations that have anything to do with treatment, supervision, counselor education should start with ethics. Right? They serve as the foundation for everything else that we do. So all supervisors should be familiar with and adhere to their ethical code. And for professional counselors, that's the ACA Code of Ethics, the American Counseling Association's Code of Ethics, which has an entire section devoted to supervision, education, and training. So the purpose of the Code of Ethics is to protect clients, protect students, and even protect supervisors, to understand how to behave in an ethical way in their professional roles. So one of the primary statements from the ACA Code of Ethics is that supervisors should have training in supervision specifically and should be operating from a specific supervision model. So this prevents anyone walking off the street to just become a supervisor, or someone who is maybe just got their master's degree and isn't licensed yet to just be considered, a supervisor. So these are precautions that are put in place for everyone's protection. So one of the main goals and edicts from the Code of Ethics is that the primary function of supervisors is to monitor and maintain the welfare of clients by monitoring the professionalism of the supervisee. Okay, so we always have the client in mind, as the central figure of the beneficiaries of our services. But the supervisor is maybe at least one person removed from the client. So the supervisor needs to be very mindful of monitoring and assessing how the supervisee is conducting their counseling sessions. Are they adhering to codes of ethics? Are they adhering to legal standards? Are they culturally informed for the benefit of the client? So that's their main role, is client welfare through the tutelage and supervision of their supervisee. So the Code of Ethics really promotes this idea that counselors should be training students, counselors in training, to be able to work with diverse populations. So you can see right from the start that diversity is promoted, diversity is welcomed and encouraged and sought in all aspects of counseling, whether it be clients or students, supervisors, and everything in between. So that's one of the main objectives, is to be able to work with different clientele. So the supervisor needs to observe whether the supervisee is getting enough education in multicultural issues, implementing these multicultural tenets appropriately, are they self-aware? Are they maintaining awareness of their own cultural knowledge of themselves and that of others? So this is very important for supervisors to be able to do. So as you see on the PowerPoint there, informed consent is one of the first things that counselors and supervisors will do right from the start. At that time, supervisors need to communicate with their supervisees what the parameters of supervision are, what the limits of supervision are, what the boundaries are, what they can expect to receive during supervision. And this is a time to make sure that the student is aware that they need to be operating and adhere to their ethical code, okay? Students must adhere to the ethical code in the same way that licensed counselors need to adhere to the ethical code. So as part of the informed consent, this is something that the supervisor would want to disclose to the supervisee. Confidentiality is a huge part of counseling in general, and that persists with the supervisor-supervisee relationship as well. So the supervisor would want to make sure that their supervisee discusses all aspects of confidentiality with their client, including limits of confidentiality, having a good understanding of what some of the limits of confidentiality are, and making sure that the supervisee discloses to the client that they're a counselor in training, that they don't misrepresent themselves in any way, to let them know that they have a clinical supervisor, that relationship exists, and that the confidentiality is going to include the supervisor having knowledge of some of the things that the client is discussing. So confidentiality is also, there's onus on the supervisor to respect the confidentiality of the supervisee, and certainly to the client themselves. So they need to take that responsibility very seriously, to maintain, make sure that there's good boundaries between their what they're sharing with colleagues or other entities, that they don't break confidentiality. So one of the ethics codes, one of the standards in the ACA Code of Ethics also speaks to avoiding multiple or dual relationships. And in the way this comes to play in the supervisor-supervisee relationship is that when a supervisor is going to agree to be a counselor and trainee's supervisor, then they need to be very mindful of maintaining that boundary, okay? And being very thoughtful about whether they would take on any other type of role for that supervisee. So we can see dual relationships occur sometimes with counselors in training or counselors and their clients, whether it may be attending a graduation or attending a very formal event or something like that. Obviously, you need to go through an ethical decision-making model to see if that is ethical to begin with. But for the supervisor to be thoughtful and typically avoid having any other role with the supervisee other than supervisor. Supervisor should not be, the supervisee should not be someone that the supervisor taught in class or has as a friend or a neighbor or a family member or anything like that. And obviously the reason for that is to be able to maintain objectivity for the supervisee's sake and for the client's sake ultimately as well.
And I do want to add to that with Matt, things to consider, especially as a supervisor, as a new supervisor. Sometimes, because if you've been working in the capacity as a therapist, your response to working with clients is, being a helping professional. So it's trying to help them through their situation or providing counseling. And within that supervision role, sometimes you have to protect yourself with those boundaries, not to allow my supervisee to be my client. And sometimes you may, fall into that role where they're dealing with personal stuff that's in connection to them providing counseling, but we're not responsible for being their clinician. That's when we refer them out, making sure they do have their own clinician, and going back to those codes of ethics of, we have to be able to balance, not taking on those multiple roles of, I'm not your therapist, I'm actually your supervisor. So sometimes you have to reiterate and remind those supervisees that that's the relationship that you have. And also with us as supervisors, we may go into that, we got to be mindful of our supervisee. They may not view us as just a supervisor. They may view us as a supervisor and a clinician. So they may try to take advantage of, our what we bring to the table, and we have to remind them. So that's something to be aware of. It happens to a lot of supervisors who just getting started. It's like, how do I balance those multiple roles? So it's something to think about when you're considering ethics, and just being mindful that I'm serving in a supervisor role. And we talked about this from that initial setting.
And to piggyback off that too, when you have if you have a small program or small group, you may take on the role of mentor as well as supervisor. And a lot of times that kind of blurs the boundaries, especially if you have a student that that you feel really close to, like for me, personally speaking, if I have another Black male counselor in training and we vibe on that level, I have to be very careful. If I'm going to be the supervisor, I can't be their mentor and friend, because that's going to blur the lines of the supervisory relationship, especially if I have to act in a gatekeeping capacity. So we have to make sure that we're being objective and mitigate those other roles that could possibly occur in a supervisor and supervisor relationship.
Absolutely. Thank you both for adding to that. And in hearing Dr. Branch and Dr. Ford telling those stories, can you hear how nuanced or how subtle it can happen? How subtle that can happen in a supervisory relationship in sessions. All of a sudden, the supervisee is treating the supervisor as a therapist, and it can be very easy to fall into that role. Now, I know not all of the participants of this workshop are in counselor education, but think about that from a counselor educator's perspective as well, how maybe professors can often be put in the supervisory role without having without having that set formally, because there's a blurred lines between an educator and a mentor and a supervisor. That's why when someone engages in a relationship with a supervisor, those parameters need to be disclosed and talked about throughout informed consent. And for this, the onus is on the supervisor to monitor if any of those subtle changes happen, if the supervisee is treating them in any other way than the supervisor as a supervisor. So if any type of, we call that like an extended relationship, or if there's any type of other extension to a relationship that is deemed, ethical, that also needs to be well documented. Supervisors always need to document the rationale for any engagement they have with their supervisee, which kind of brings us to the next point, that supervisors need to maintain accurate and timely records. This is so important on so many levels. It's really important, obviously, for legal and ethical reasons. It's really important to document, to model for students and model for supervisees the proper way to document. So anything that is noteworthy needs to get down on paper. They say if it wasn't written, it didn't happen, right? So being able to maintain healthy boundaries and not multiple roles leads us into not having romantic relationships, right? So that's a big issue, and is really important to understand that it's not even just sexual relationships, but romantic relationships, intimacy, anything outside of the supervisor-supervisee professional relationship is prohibited. So Obviously, that's for protection of the client and the supervisee, because that's going to impair objectivity, right? A lot of problems could come about from that. Favoritism, treating one person differently than another, there are liability issues, of course. So a lot of problems can come from that. So, the ACA Code of Ethics explicitly states that supervisors should not engage in any type of role that would impair their objectivity with their supervisee.
And in addition to that, and I see Maria shaking her head, which I love. Thank you, Maria. Thank you, Maria. Some people don't. Some people just like, oh, you're not supposed to do that? I didn't know. So yeah, thank you for that. And also think about from a supervisory role, we're modeling behavior. So if you're modeling behavior, this is behavior that the client, your supervisee can consider when working with their clients, where there is a strict boundary there of you're my client and you're my supervisee, and that's all you can be. There is dual roles, dual relationships that we have from supervisor to supervisee as far as mentorship, as Dr. Ford mentioned. But with your client, if you're a client, that's what you will always be. Once a client, always a client. So if I'm modeling behaviors, I'm teaching my supervisee how to establish and maintain healthy boundaries.
Yeah, and that really can be a broad spectrum of any type of inappropriate boundary with the supervisee. That kind of leads us into the idea that supervisors really need to be monitoring themselves, quite a bit, right? Supervisors need to be hold themselves accountable or accountable to others as well, but to monitor their own thoughts, their own feelings, and to intervene if any of those ideas do come to mind that might, lead you to breach that supervisee-supervisor relationship in any type of intimate, romantic, sexual way, of course. So that speaks to the cultural considerations as well. Supervisors, according to the Code of Ethics, really are required to assess themselves periodically and have a continual understanding of their own personal culture. Okay, each of us has an individual personal culture within the broader culture. So to understand and be aware of ourselves and how that might impact the supervisee, right? Because ultimately, anything you do that impacts the supervisee is going to likely to impact the client, right? So we want to make sure we do no harm to the client. So the more aware that the supervisor is of their own personal culture, how that might interact with the supervisee and their culture is really important. Okay, and it's also expected that supervisors will actively integrate cultural considerations into the supervisee's sessions, right? They openly talk about, cultural matters, openly recognize if there's any differences between the supervisor's culture and the supervisee's culture. As we mentioned in our introductions, some of us have seen issues come about from that, especially when they're ignored, especially when no one brings it up. And in doing so, if you're monitoring yourself and if you integrate these cultural considerations with your supervisees, that's going to give you a lot of opportunity to be the gatekeeper, right? So part of our professional standards are to be a gatekeeper for the field in general, meaning noticing when there are problems and intervening, okay? So if you're working with a counselor in training that and you're bringing up cultural issues and the supervisee is having some difficulties with some of those concepts, those topics, or implementing them with the client, then some interventions need to happen, okay? Because we don't want to have counselors in training become licensed counselors who now have very little awareness of multicultural issues, a lack of respect for multicultural issues, have not worked through any multicultural issues, from everything, from racism, discrimination, sexism, anything that could impair their objectivity to be a multiculturally competent counselor. So I think gatekeeping is a big part of what ethics enforce, or promote for us. We need to take that role seriously. And, similar for counsel. David, do you want to say something?
No, you could.
So kind of take that to the next realm of counselor educators, right? So the ACA Code of Ethics, encourages counselor education programs to specifically promote diversity in their faculty, diversity in their recruiting, of the student body. That's for everyone's benefit. We all benefit when there's diversity of all different types. And counselor education programs are directed to integrate multicultural frameworks into their lessons, multicultural theories, to broach cultural topics and all of their different courses. So the Code of Ethics applies to licensed counselors, the supervisors, and the people training them. Okay. You want to say anything else on that before we move to the next slide?
I do want to jump in a little bit on gatekeeping. It's important to remember that your supervisees are working under your leadership and under your license. So if you feel uncomfortable about how your supervisee is managing clients or working with clients, at any time you can, I think it's important to have that discussion within supervision with them and provide a plan for them to kind of get on track with being ethical and following directives as far as keeping their client safe. And if they're unable to do that, you can release that supervisee. You can fire them technically. If you want to fire that person, you can, because they're working under your license. But not only releasing them or letting them go, but you can report them as well if they're not able to just follow suit. And that's part of gatekeeping as well. We want to make sure that we're protecting clients at all times. And for some supervisees, we got to consider personality differences. Some people may not, personality and culture and identity and different things of that nature could make it difficult for them to process working with certain populations. So if that's an issue, you have to bring that up in supervision. Like, it's our responsibility as supervisors to talk about those really difficult conversations. And if you notice, and we'll talk about this as we go through, if you notice some of your supervisees, they may not talk about certain areas, but the type of clients they may be working with, or they may shy away from really tough conversations. It's our responsibility to have those really tough conversations, because if they can't have it with us, how can they have it with their clients? So that's part of gatekeeping as well. So keep those things in mind. We do have that ability to make sure we're serving the client population even indirectly. So keep those things in mind.
No, that's a huge point for supervisors to be vigilant of any red flags, related to any type of cultural issue. And you were talking a lot about race during this presentation, but culture can mean a lot of different things, as Jason mentioned, different populations. So we have some landmark legal cases in our very recent history that stem from that, right? So for counselors in training, having difficulty working with people of different populations, that needs to be addressed, not ignored or overlooked, and and reported, right? Even for licensed professionals, for that to be reported to the state authority. Because you have to remember, even if something is legal, that doesn't make it ethical, right? So we need to adhere to our ethical standards of our license. So if we're modeling for students, we need to monitor how their cultural competence is playing out, right? Or not competence. Shall we move to the next slide?
Sure.
So we're talking about professional expectations here of supervisors. And for anyone that's not familiar, the Association of Counselor Education and Supervision, the abbreviation is ACES, that's one of the founding divisions of the American Counseling Association. And they, in 2011, decided to get together and address how can we support and how can we guide supervisors in their supervisory role, right? So as everything, we want to do well-researched and well-supported concepts. And so they created what they call best practices in supervision. So they're basically just a guideline for clinical supervisors to achieve the best standards possible in the industry. It's not a minimum standard, doing the very least, but it's something to strive to. If you're adhering to all the different standards in the best practices model, then you're doing a very good job of your supervision, okay? So this document is designed to supplement the ACA Code of Ethics. It doesn't replace it, you know, or supersede it, right? We have to be mindful of maintaining the ethical standards while also implementing best practices, you know, in supervision. So when reading through the ACE's best practices, it's really easy to see how cultural issues, cultural awareness, multicultural themes are everywhere. They pervade the whole best practices guidelines. So there's, you know, whole sections on it, but also it's integrated into other sections of the best practices also. So I interpret that to, you know, I perceive that as showing how important multiculturalism is, how important it is to integrate cultural themes into your work and into your supervision. So just to go over a few of the standout standards from the ACE's best practices. So standard 1.5, supervisors initiate conversation with supervisors regarding cultural identities. The supervisor is the person who needs to initiate the discussion about race, gender, sexuality, SES, age, anything related to a person's culture. And the onus is on the supervisor to bring that up, and ACE's best practices highly recommends that get done in the first session, okay? So this is not a topic to avoid or to punt or put off to a later time, but being able to broach the subject of diversity and multiculturalism with their supervisee in the first session is paramount. Now, there's wisdom in not only talking about that in the first session and hyper-focusing, but I think the tendency is more to avoid or just neglect, you know, bringing that up. So it's important for supervisors to be able to initiate those conversations and broach those topics with their supervisees. And as part of that, supervisors need to continually assess themselves to gain more and more awareness of their own personal culture, right? And we've all done that in our master's programs and maybe in our doctoral programs or occasionally, but it's important to do that throughout the course of your professional career because we change. If nothing else, our age changes, right? So that might change our perspective on a few things. So if I don't recognize that I'm changing as a human being and thus changing as a professional as I age, if nothing else, then the supervisee is going to be at a little bit of a loss. We need to reflect on, introspect, and ponder how our personal culture is exhibited and received by others, right? So especially in the supervisee-supervisor relationship, how might that be impacting the supervisee, right? So if we have the topic once in the first session and never bring it up again, or if we don't think about it for ourselves, if we think, hey, they're the supervisee, they need to be thinking about this. I need to tell the supervisee that they need to be thinking about their personal culture and, you know, becoming aware of their biases and privileges and any power that they might have or how it might affect their clients. That's really kind of keeping it external when, well, obviously we want to model and do best practices, therefore we must practice what we preach. So we need to not just externalize it to the students or to the counselors in training, but to practice it ourselves as well. So to that point, one of the standards refers to how supervisors need to continually attend to any cultural issues. If they noting cultural differences, noting when a supervisee brings something up that could be culturally related that the supervisee doesn't have insight about, right? So we want to make sure that anything that is about our personal culture isn't impacting the supervisee in a negative way. So it's the onus on the supervisor to monitor for that, anything coming up between them and the supervisee themselves, and to address that. Unfortunately, it seems that, cultural issues are often maybe neglected, or people maybe shy away from bringing them up and addressing. But in the supervisory role, you need to be able to have that skill, and comfort and confidence to broach those subjects with your supervisee. Unless anyone has anything else to say, we can go to the next slide. So if you haven't caught on yet, the broader concept is that all supervision is multicultural supervision, very similar to how all counseling really should be multicultural, culturally informed, right? Ethically informed. All counseling is ethically, and all counseling is multicultural. So supervision is the same. We start with our ethical standards, and we move to being able to operate from a multicultural lens in our supervision. So again, this is not just that, hey, let me broach the subject in the first session with my supervisee and forget about it. It's the idea that cultural perspectives should kind of pervade the relationship, all the different sessions. It should be monitored, assessed, be made aware of, and things even like power and privilege are so important to address in the supervisory relationship. For the supervisor to be able to introspect and recognize your own power in the role that you have, and to have empathy for the supervisee in their role, and not to abuse that power. For the supervisor to be able to recognize privileges that they have, that the supervisee may not have, right? So privileges are something that we have not earned. I have the privilege of being a middle-aged white male, and so that comes with it certain assumptions of privilege that maybe clients, supervisees of different races or genders or ages don't get, that I get. So I need to be very aware of how that is informing my supervision, and help the supervisee become aware themselves of their own power and privilege as well. So they may not recognize the power that they have as a counselor in training, especially in the supervision sessions, because in those sessions, they may perceive themselves as the lower status, one with less power. So we need to continually remind our students and the counselors in training, our supervisees, what powers they do have, what privileges they have, and how those privileges are affecting their relationship with the client, okay? So the idea of integrating cultural themes throughout supervision, throughout the supervision process, not just a one-time thing. So similarly, we need to practice that, but we need to educate and support our supervisees doing that as well. So for supervisees to be able to learn from supervisors how to integrate cultural themes, how to broach multicultural topics, how to have some of those difficult conversations, how to be able to operate from a culturally competent lens or culturally responsive lens, and certainly a culturally humble framework, right? So I think that these topics are going to come up continually in supervision, so supervisors need to be ready for that. And if the supervisee is not aware enough to bring them up or doesn't ask these questions, the supervisor needs to do that themselves, right? And a big part of that, looking at standard 7E here, that very often we're supervising maybe master's level students, or novice counselors, recently licensed counselors that may not have quite the experience that you have, and may not have had a great deal of cultural training in their programs, or may be working with non-diverse, homogeneous clientele populations. So they may have a lot of what we call blind spots that they may not be aware of. You know, blind spots are places where you're unaware that you have power, that you have privilege, unaware of how your personal culture impacts another person's personal culture. So the supervisor's role is to be able to help the students become aware of those things that they are missing, you know, through their cultural lens. We all have blind spots, every human being. We need to continually to work on, you know, lessening those blind spots, but supervisees in particular are maybe a population that is highly unaware of their own personal blind spots. And so that's a topic we need to bring up with them. So some basic tenets of the best practices is that the supervisor has to be competent multicultural counseling. Now that might seem self-evident, but not everyone is. You know, the supervisor needs to get obviously their master's training, their license, but also get continuing education, right? So you need to be able to practice your skills in a clinical setting, be able to you know, demonstrate how your competence in multicultural counseling or supervision plays out, right? So I think it's important for with this best practices to point out that not just anyone can do supervision, okay? If you don't have these basic skills, if you don't have this self-awareness, if you don't have the training, you know, then you shouldn't be engaging in the supervisory relationship. And we've talked about this already, 11D, just being able to explore your own cultural identity. That's going to change as we go along. It might mean different things to you at different times of your life. If you discuss it with colleagues, your therapists, your confidants, then you might gain more insight into yourself, right? So this is something to continually, practice. Did anybody have anything else to say before we move on to the next one? So we're really kind of focusing on professional expectations here. And I feel that apparently I have more to say before we move on. We're talking about professional expectations. This is setting the groundwork, really kind of laying the foundation for the rest of our presentation in cross-racial supervision. Okay, so these are best practices, these are ethical guidelines, these are professional standards, these are things that we should all be doing as supervisors. I encourage you to keep these things in mind throughout the rest of this presentation, because they're going to inform some of the other topics that we discuss. Anybody want to say anything before we go to the next slide?
You killed it, man.
Don't get me started. We only have 3 hours, David. We only have 3 hours. Don't get me started. So had we been live in person in all one big room together, as certainly we had hoped, we would have asked you to break out into little groups and maybe discuss this issue here, what we've talked about so far. But for now, I'm just going to ask you to ponder this question and add it to the chat box so that we can kind of bring some of the topics to light. So we're interested in hearing your experiences that you've had in your role as a supervisor or as a supervisee related to any cultural issues within the supervision, right? So you can think of about all kinds of things. Was there ever a problem that occurred in your supervision related to a cultural issue? How was the problem approached? If it was approached, was the subject even broached? How was it resolved, if it was resolved, right? Think about issues of power and privilege in the supervisory setting, and how did that play a factor in the problem that you're going to discuss?
Also with that discussion, if if it's a paper that you want to, that you're going to write us in the chat box, just say it. Just unmute yourself and verbalize it. You should have that ability, because I know some of these questions you may end up writing a whole dissertation just to ask the question or share your experience. But yeah, you can verbalize it or you can write it in the chat box.
I encourage you to take a minute to introspect and think about this over the course of your supervisory career, your career as a counselor, your role as a supervisee, something that was problematic, something you wish was brought up that wasn't brought up. All kinds of things can come up for you. So,
hi, my name's Dorothy.
Hi, Dorothy.
I am a doc student, and I supervise interns, master's interns. And often we get international students, from like China or, Kazakhstan or wherever. And what I find is that sometimes I have this idea of what counseling is, but then it doesn't necessarily fit with the personality or the culture from where the person's coming from. So she's going to go back to China, and there's going to be cultural differences there and things to think about when she's sitting with other Chinese people doing counseling, and I don't know anything about that, and so one of the ways that I kind of tried to broach this situation was by asking her, because you could tell there was a hesitancy in her when she was approaching or talking to her client and not wanting to challenge them when it was appropriate, because that wasn't part of her culture. And again, it's okay maybe to do it here, but then is it okay to do in China? And so I was wondering what you guys kind of thought about that, and how would you approach that?
Go ahead, Matt.
Okay, Dave. I was just going to say that one of the ethical standards for the ACA is for us to continually gain education and training and information about multiculturalism. So it's unrealistic that any of us will be an expert in every single culture that is, obviously. That's why we're kind of moving away from the concept of cultural competence to cultural humility or cultural responsiveness. So in this supervisor's role, you may just kind of go that extra mile to not just learn from her, your client, your master's student, about her culture, but to explore it, on your own. So that might inform, your culturally informed supervision, of her. I also think that it's something to just work together with her and collaborate with her on, not necessarily just to have the answer that you spoon feed for her, but to kind of work through with her in collaboration through her cultural lens.
Mm-hmm.
And I want to find out, okay, so present a scenario with her in vivo with you and her. If this were to happen in China, what would you feel comfortable doing in a situation? Because like you said, what may work here may not work there, but still she was trained here as a supervisee, and so when she's in a supervisory role, what will be appropriate for her in her own country? So, not challenging her worldview, but having her integrate her worldview into her role as a supervisor, and giving her the tools to do that in a way that respects her culture, but also makes sure that her supervisee learns from that situation. Does that make sense?
Yeah. So think of it through what she would be doing here, but then also what might be different there.
Yeah, so letting her come up with the solution instead of you teaching her the solution, having her think about it from her own cultural lens and be able to integrate it into the supervisor relationship.
Mm-hmm. Okay.
And I like to add to that as well. And I would suggest for the student to, when she goes back to China, to connect with other professionals there. Because from my understanding, the training is very similar to what we have here in the United States. And the challenge is working with those who are more traditional based. And so there are models that professionals within China are working with. And, you know, doing the role play is great, but I would also include the how she can connect herself with other professionals and get mentorship and additional training as she transitions back to her home country.
Thank you, Dorothy. I hope that helped.
So there was a question that came up in the chat box, and it's kind of 2 for 1 related to religion, religious practices related to certain clients. So someone mentioned about having a Muslim student having prayer at sunset during a supervision session, and the student religion is against working with the LGBTQ community. So some things to consider. When it comes to you and your supervisee, you two decide as far as your schedule, when you meet, when you don't meet, and what goes on during the meeting. So if this Muslim student needs to meet at a certain, or needs to have prayer at a certain time, then you may not want to schedule your supervision sessions during those prayer times. If that supervisee schedules that time during prayer time, then that's kind of a disconnect between the therapeutic relationship between you two, because it, you know, the prayer, is nothing wrong with the prayer, but the prayer interrupts having this supervision. So how can we have supervision for the first 10 minutes, then you got to go pray for 30 minutes, then come back? We need to schedule a different time. And you can have that honest conversation where you're still respecting that person's religion. They can still practice their own religious practices, and it doesn't stop anything. So that's more about scheduling than anything else. It's not stopping them from doing what they do. It's just scheduling a time where we may need to meet at a different time when you may not have prayer. The second piece about students working with the LGBT community based off religion, or religion related to any culture, any population, we have to really dive into these hard conversations. And as a supervisor, we're in the driver's seat to have these tough conversations. And part of those conversations is challenging your supervisee to process what is it about this certain population that's causing this disruption with you. If it's religious based, what does your religion has to do with this person's personality, perspective, or what they do? If my client is a vegan and I'm a meat eater, what does me being a meat eater have to do with this client being a vegan? No disrespect to vegans, but what does it have to do with you doing your job? Absolutely nothing. So therefore, this is an opportunity for us to work on you getting out of your own way. And that's not disrespecting anybody's religious beliefs, practices, but this is you as a person. You have an issue with this certain person because of your beliefs. Let's challenge those beliefs, because now this person may have chose you to be their therapist, and you're shunning them or telling them no because of your belief about what they choose to do or choose not to do. And to me, that's more judgmental. And if we're in this profession not to be judgmental and open to work with anybody, then that says something about us. Something that I share with my students all the time, us as clinicians working in this profession, we should be able to work with anybody. So if an alien came from outer space, green, smelly, slimy, they should be able to come to us first before anybody else. And in order for me to gain more information about life as an alien, this is my time to get educated about what it means to be an alien, what it means to be green, what it means to be slimy, what it means to be stinky, whatever that is. It's my role, it's my responsibility to learn about this client, because that client is that client. That alien doesn't represent the entire alien community or population. There's some work to be done. And to me, in supervision, it's a great space to really dive in and challenge that supervisee's belief system, not their religion, but their belief system. And if you really dive into things, you can have those conversations where people are able to separate the two, because we're talking about a person, not the person's religious practices. And religion and spirituality are two different worlds. So, you know, religion set of principles, practices, rules that we follow. Spirituality is from within. So we can differentiate and have that conversation to prepare that supervisee to work with anyone. And to me, if that person isn't able, isn't willing, isn't ready to work with anyone, then we may have to go back to a couple slides when we're talking about gatekeeping. Maybe this profession isn't for you, because if any community, if everybody shunned them, the whole society shunned them, and they come to us first and we say no, who do they have left? No one. So having these conversations and putting things in perspective for your supervisee kind of helps them see a bigger picture, or it gives them a different lens to look at. So consider those things when we're working with people who may struggle with certain populations. There's a reason that there's a struggle with a certain population. And to me, that struggle is more within than anything else.
And let me just add, Jason, because I think that is fantastic. I'm so glad you said that. I would also have be very aware of any students or supervisee who take on a position of like, well, I'm struggling with this, so I will refer that client to someone else. That is not an appropriate use of the referral process. So challenge any student or supervisee who takes on that mentality that this is an option available to them.
Maria, I think you had a point.
Just real quick, it was something to say that I tell my students that, yes, discrimination is discrimination is discrimination, but also to know that pain is pain is pain. It all looks the same, but even more so, just because a client identifies as an LGBT plus community member doesn't mean that that's what they're there to talk about.
Absolutely. Great point. Great point. And for the supervisee to assume that says a lot about them as well. It's an assumption. It's an assumption. Excellent thought.
David, I'd like to address another one of the issues that brought up in the chat box if we have time.
Sure. Yes.
So if everyone can see the one that came through about ageism, okay? When I was a supervisor, a supervisee was older than I was. She was discussing how she felt that respect was deserved based upon her experiences in being older. The idea of ageism was discussed. I feel like although the issue was discussed, it was not resolved. So this person was left with a couple of questions. How is this going to play out into the supervisee's like sessions, as a counselor, and her or my perception as a supervisor who's younger than some of her supervisees or clients? I feel like a lot of the things we talked about really fit into this theme. So we've already talked about maybe like an ethnic issue that Dorothy brought up with her Chinese supervisee. We talked about religious issues that was just brought up. Now we're talking about another type of culture, is ageism. And I think there's a lot to address here that we can learn from, because first of all, to me, it was discussed, which is great that it was discussed, but sometimes things are going to have multiple discussions. They're going to require multiple discussions, and may need to be brought up periodically throughout the sessions. So if this supervisor is perceiving that the supervisee feels disrespected, or if the supervisee says something negative about the supervisor, she might be able to bring it up and say, hey, this reminds me of, when we talked about the ageism. Do you think that could be coming at play here? I also feel that there's a fair amount of assumption going on when the supervisor says that, that the supervisee says she deserves respect. I would be curious to ask that supervisee how she felt disrespected. I would trust that the supervisor in this situation was not being disrespectful, or had no intention of being disrespectful, was not attempting to be disrespectful, yet the supervisee felt disrespected in some way, potentially. So being able to ask, how they felt disrespected, and to have that conversation about, mutual respect. So, and then it also, I think, speaks to gatekeeping, as Jason was just mentioning in the other scenario. If you're worried about this playing out in her counseling sessions with her clients, and her ability to respond to supervision and to, accept feedback and implement feedback, then that's a gatekeeping issue that, again, will need to be brought up and monitored and intervened if necessary.
Awesome. Thank you all for sharing all your stories and listen to this. As a supervisor, we have to make sure that we are monitoring these, different conversations in the very beginning. And then we're going to talk about cultural broaching later in the presentation. But we have to, if you're going to be a gatekeeper for the profession, you got to have that gatekeeping hat on from the very beginning. And gatekeeping is not always punitive. It's a way for us to sit down and have this conversation with our supervisees about, okay, I know some things, let's talk about this. Now, if they don't get it, then we can take it a step further. But that initial conversation is we had from the get-go. This is my role, and I've noticed this, let's talk about it. That's the first, that's at the very beginning of the relationship. So gatekeeping doesn't come back on the back end and surprise the supervisee that we're taking this stance.
And in addition, I do want to address the comment made by Tiffany Rush Wilson. Thank you for the comment. And it's working with different supervisees, or this is for those of you who have supervisors or in that supervisor relationship and you're the supervisee. Please know that it works both ways. Just like a supervisor have the ability to release or refer their supervisee, you as a supervisee have the ability to release or refer your supervisor. You're paying someone for a service. And if you're not getting the service that you need or that works for you, fire them. I'm sorry. Release them. Release them. Let them go, because it may not be a good fit. And I do agree with Tiffany's response. Like, we do learn two things from people, what to do and what not to do. So you may start off as a supervisee, but with time and in years, you are going to become a supervisor. So think about what that's like for you as a supervisor if you're not agreeing with some of those methods or how that person works. Also, just because a person is a supervisor doesn't mean they have done their own work and dealt with their own stuff. So some supervisors have their own biases that gets in the way, their own beliefs and stereotypes, and they haven't done the life work, even though they're in this profession, which is hard to even understand. How are you in this profession and a supervisor trying to help me and you haven't helped yourself yet? So if you're having those feelings and those thoughts, it says something, and it's as the supervisee, it's your responsibility to make sure you're getting your needs met. And if they're not met from that supervisor, it's time to it's time to release that supervisor and find a new one to help you get your needs met, because that's important for your development as a clinician in training.
All righty. Good job, everybody. Thank you all. All right, Dr. Branch.
Okay, so clinical supervision. As y'all can see, I get excited about life. That's just who I am. Welcome to my world. So clinical supervision, what is it? We talked about the groundwork. We talked about that foundation. Now we're moving into building this connection, this relationship. So clinical supervision is an intensive interpersonally focused one-on-one relationship in which one person is designated to facilitate the development of therapeutic competence in another person. What this means is you are wearing multiple hats at all times. And you're able to work with the client indirectly. So as a supervisor, you may not ever see any of these clients. However, you're connected with them. You're working with them indirectly because you're using your therapeutic connection with your supervisee to work with that client. So even if you'll never see this person, you'll hear the stories. You may get an audio tape, maybe have a videotape with your supervisee. You're getting information, and this is how you're conceptualizing your supervisee's client. So not only conceptualizing the client, you're conceptualizing the supervisee. Then on top of that, you're conceptualizing yourself. What's going on with me? So with so many different roles, so many different layers, it's endless, because not only am I supervising myself, I'm thinking about those above me. So whatever agency you may work in, if clinical director, I mean, you name it, there's just so many. So when you're balancing and managing those different layers, you have to balance and wear multiple hats. And that's a difficult job to do. It's a very difficult job to do because there is no textbook on how to do it. A lot of this stuff is trial and error. And for some of us who still have this complex that I have to be perfect, you fail miserably. Why? Because you're trying to do it the quote right way. There is no right way. It's your way. And your way is the best way because you're doing the best you can with what you have. And that's more than enough. So understand, when you're balancing these multiple roles and you're doing all this different work, you have to consider yourself too. Am I getting therapy? Am I seeing a therapist? Because I got some stuff I need to work on. Am I working on my own cultural awareness and addressing my biases, my beliefs, my stereotypes? Because some of us as supervisors haven't done that work. And the reason that a lot of us haven't done the work is because we don't have to. Once you cross the ranks, getting your master's and getting your doctorate, No one's holding you accountable but you, until somebody reports some unhealthy or unethical behavior. So you're kind of working in isolation by yourself. So that means you have to manage yourself even better than anybody else could manage you. And that's difficult because it forces you to look within. So if looking in the mirror, looking within scares you, then you should do it. I'm highly recommended it because we have to be willing to become comfortable being uncomfortable. And if you're comfortable doing supervision, you're not working hard enough. If you're comfortable as a clinician, you're not working hard enough. If you're comfortable with who you are and where you are, you're not working hard enough. So yes, I am challenging you to deal with yourself, because the more you're able to have that self-awareness and deal with you, the better you get to serve as a supervisor, the better you can assist your supervisees with working with their client, the better you can assist those clients that you work with indirectly. It's a cyclical process that starts with you and ends with you, because everything you do has an effect on the entire population when it comes to providing services. And a lot of times we don't think about that. We just think about the one-on-one relationship with you and that supervisee, but you're having an indirect effect on that client as well. So
Jason, can I?
Please jump in.
No, you're such a wonderful and passionate speaker. It's really hard to interrupt you. I'm sorry I did, but I just want to point out there's a great comment in the chat box that relates exactly to what you were just talking about as far as the accountability, where Angel says, also hold the supervisor accountable to outline their approach and commitment to maintaining that framework throughout the relationship. Sometimes a supervisor can start off strong in alignment with the agreement and then fall off or get lazy. So you said, like, you need to, the supervisor can hold the supervisor accountable as well.
Yes. So the roles work in both ways. Just because you're a supervisee doesn't mean you don't have any power to bring those topics up. And one thing I love about supervision is we're not working with a client. So you can be transparent, you can be vulnerable, you can be transparent, you can self-disclose, you can do a lot of things that you probably wouldn't do in a session. So as a counselor in training and you're getting supervised, if you're seeing my supervisor was holding up at a certain standard and then 5 months in, the standard is dead, you can bring that up in conversation. And we are all counselors or counselors in training, use those therapeutic skills. I've noticed that you're not on time for sessions anymore. I've noticed that you've canceled on me 3 times. I've noticed that when we're in session, you're talking about what went on TV yesterday. I'm trying to talk about my clients. You can have those honest and tough conversations because everything that you do for a supervisor perspective or a supervisee, you're modeling behaviors that's going to happen between you and that client. So to me, go ahead, David. I'm sorry.
I'm sorry. And another comment that came in the chat box from Maria: we cannot give what we don't have, and that thing is like that'll preach on its own. Can a church say amen? I mean,
absolutely.
I mean, part of my friend, you got to deal with your own shit before you can deal with somebody else's shit. And so, as a supervisor, if we don't deal with our own stuff, there's no way we can teach our supervisors to deal with their own stuff too. And so I need to take care of myself and the own stuff that allows me to not be comfortable with who I see in the mirror. Then that way I can give my supervisee the tools to do that as a supervisee. And then when they're counseling their clients, so the clients won't see them as inauthentic, they can also deal with their own stuff. So it's a parallel process, but I have to set the tone. If I don't have it to give, I can't give it to you.
Absolutely. Thank you for that. In addition to wearing the multiple hats, serving in these multiple roles, a lot of us as supervisors are burnt out, compassion fatigue and burnout. And a lot of times when some clinicians are dealing with compassion fatigue and burnout, they don't know it. They have no idea that it's happening. So a lot of times, like with Angel, what she mentioned, the supervisor starting at this level and then it goes to a different level later. Sometimes that happens because of the lack of self-care, the lack of balance and boundaries. So if you're balancing multiple roles, you have 5 supervisees, you got 30 clients, you're working as a faculty, you got a family, you got a dog, you got all these things and you're trying to do them all at 100%. And it's almost impossible, especially for some who have that perfectionist attitude where I have to be great in all. You can't. So therefore, it's how do I find that balance to make sure I'm taking care of myself. So if I'm taking care of myself, I can take care of those around me. So you can go to the next slide. So supervision, again, multiple roles, multiple hats. Monitoring the supervisee's performance. This is a task that you are doing every week. Every week you're monitoring your supervisee's performance, meaning every session should be concurrent where we're dealing with things from the last session that brings up to the current session, all the way to your very first session that you have with this client, this supervisee, all the way to the current session you're having. Even if this is years, everything is working hand in hand. So when you're monitoring their performance, you're not just monitoring what they're doing with their clients, you're also monitoring what they're doing themselves. So when it comes to that balance and self-care, are they practicing self-care? Do they have balance? Are they maintaining balance? Are they doing the homework assignments that you assign? Are they doing the things that you recommended? And that goes by behavior. We're monitoring behavior, not just what's stated, but what they do. And you're able to monitor that in a lot of different varieties. So that monitoring piece kind of helps you track what they're doing and what they're not doing. And if you're providing assignments and different suggestions and they're not following suit of those, then it may have to have a conversation of, hey, I recommended these things, we didn't do anything, what happened? Let's talk about it. And that's not trying to be a person's clinician, but this is serving as a supervisor. You're being inconsistent. You're not being congruent with what you said we wanted to do. Have a conversation about it. Protecting the welfare of the clients. Again, we are indirectly connected to those clients. So if you are noticing that your supervisee is having some blind spots when it comes to working with certain groups or populations, then you can bring that conversation up in session. Please know that a lot of these conversations are very difficult to have because they're uncomfortable. They're uncomfortable conversations. But if I can't have this uncomfortable conversation with my supervisee, how can they have it with their client? So we have to not only model this behavior, but what are we talking about it? Not just actually physically showing, are we discussing it? So we're thinking about, we're putting the client first. So, and that's part of ethics as well. So I'm protecting the welfare of my client. How can I protect my clients indirectly? There are several different ways to do that. And part of it is checking in on that client based in with your weekly supervision. What's going on with client A? You mentioned client, this couple from last week, or 3 weeks ago, you mentioned a couple. I haven't heard about them in a while. You are still setting the tone and you're holding your supervisee accountable to make sure their clients are being taken care of, because their clients are actually your clients as well, indirectly. Gatekeeping for the profession. I think Matt dove into that and gave a lot of information related to it. Same rules apply with gatekeeping. The relationship between supervisor and supervisee is very similar, as in you have rights, responsibilities on both ends. So if not if your supervisee is getting on your nerves, that's not when we let somebody go shaking. Not if they're getting on your nerves, but they're doing some unethical things or violating some things. Yeah, we have to have a conversation because it may not be appropriate for us to continue this relationship. Same thing for a supervisee. If you're not getting your needs met from your supervisor, you can release them and find a new supervisor. So when you think about gatekeeping for the profession, for a lot of supervisors, I think it's very important that you interview your supervisee, your potential supervisee, before hiring them. A lot of supervisors don't interview. They just take somebody on. And to me, there's a risk when you don't interview. The interview process helps with gatekeeping. It also helps with, are you able to work with people that you're compatible with? Because there's personality differences that we have, and we may not be able to work with certain people, or it may be more difficult. Also, can this person meet my expectations as a supervisor? I may be very, punctual with time. I may ask for a lot of assignments. I may ask for a lot of documentation. I may ask for an audio or video recording. I need to know that this supervisee is willing to meet my standards as a supervisor. And some people cannot, and that's okay. They can find a supervisor who can meet their needs. Same process happens for supervisees when you're thinking about supervisor. Interview them as well. You may meet some supervisors who may not be a good fit because they're not punctual, they're not consistent, or whatever the case may be. So it works on both ends, and that helps with gatekeeping. Promoting supervisee growth and development. This is their professional and personal development. If you notice when working with supervisees, a lot of times their personal stuff comes out. It's just the nature of this profession. It's going to come out, and as a supervisor and clinician, you're going to see them. You're going to see them clear as day. There's some relationship issues going on. There's some, health issues going on. You can see them. You can address those things, and you can address them to let that supervisee know, hey, I'm noticing these things. Have you spoke with your counselor about it? When's the last time you saw your counselor? Have you considered counseling? What's the reason you're not going to counseling? So that's helping them with that personal growth. The professional growth is enhancing those skills. The skills, their theoretical orientation. Are they enhancing their orientation by doing reviewing research, going to workshops, enhancing their skills working with clients? So we're responsible for observing and holding those supervisees accountable for professional and personal development. And the last is empowering the supervisee to self-supervise and carry out goals. This is one of my favorite aspects of supervision. This is when your supervisee begins quoting you, okay? When you hear your supervisee quoting you, that means they're getting it, they're figuring it out, they're supervising themselves. Meaning, if they already know what you're going to say before you say it, you're penetrating, it's making sense, and they can start doing this on their own. A lot of difficulty supervisees have is trying to emulate someone they are not. They may try to emulate you, they think you're great, and they want to do exactly what you're doing. Our job is to help them become the best version of themselves. So therefore, if I'm becoming the best version of myself, how can I try to be like Dr. Branch? You can't, because you're not me. So it's holding those supervisees accountable and encouraging them, empowering them to have their own self-development and professional identity. That's for them. So instead of them quoting me, I want them to start quoting themselves, and that's how I know they're able to self-supervise. So it may start with, oh, Dr. Branch, you would say A, B, and C. Now, what would you say? What would you think? What do you expect? And that's empowering them to carry out their goals, because that supervision relationship is temporary. And after the time is up, they know they have to be empowered and independent enough to make these decisions on their own without any support or assistance. That support and assistance becomes optional and not required. I could talk about this all day, but I'll stop. Questions, comments in addition to that?
It looked like there was a really good little conversation going on in the chat box about, when a supervisee doesn't believe in counseling.
Okay.
Big part of gatekeeping right there, right, Jason?
Yes, the supervisee don't believe in counseling. Why are you talking to me? We ain't got nothing to talk about. I'm a supervisor who provides counseling services. You are a supervisee trying to become a clinician. How do you try to become a clinician in something you don't believe in? And to me, I think even if this person isn't your supervisee, these are great conversations that you can have with a student or with a potential supervisee. And Dr. Sapp said, they made it out of a graduate program. Yes, there's a lot of students who make it out of graduate programs and got no business making it out of a graduate program, but they do. And it's for going back to that gatekeeping, you'll notice the students who get through these programs who probably could use a little more assistance as far as their development. It's our responsibility, even if you're not connected to the supervisor as in they're paying you for service, it's our role to mentor, support, and guide them and help them get better, because they represent our entire profession. So just to break it down a little bit of how this trickle-down effect works. All of us know at least one person who had a bad experience with a clinician. All of us know at least one person, directly or indirectly. And imagine if, let's say, John Doe. John Doe is a potential client. He has a horrible experience with his clinician. John Doe is going to share that horrible experience with so many other people. Therefore, you represent those other people, because now the rumor or this belief that counselors are bad, the counselors are not good. That was one unhealthy experience. One thing that I love and hate about humans is a lot of times we give everybody else a second chance, but when it comes to counseling, we don't. For example, if you have bad customer service at McDonald's, do you stop eating at McDonald's? No, you just go to a different one until you go back to your normal one. But if I have a bad experience with counseling, typically I'm not going to go back until I get some information that lets me know that it's not the same. So some clients, especially if they've never experienced counseling before, have an idea and belief about counseling that may not be valid, may not be factual. And it's our role to help those people get a different belief or perspective about it by educating them. We can't change anybody's ideas, belief, whatever, but I can educate you to help you make some decisions because you represent the entire counseling community. And if I'm a part of this, I want to contribute to helping those clients. Excellent thought.
That's called advocacy for the profession.
And that's a 24-hour job.
Yes. Yes. Oh, yes.
Just very quickly, just to say, anecdotally speaking, I had that personal experience of having to have that conversation with a master's level student that was in a class that I was teaching. It was a drug and alcohol class. And the student was saying just openly in class, disparaging things about people with addictions. And it was, you know, really noteworthy in the class and very rigid, very, very rigid thinking. And then needing to speak with the student about counselor tenets and principles like empathy, you know, right? So the person really seemed to lack empathy quite a bit. And, you know, there was a referral and interventions that had to be done afterwards. I don't want to say what the end conclusion was. It wasn't good for the student.
And the last thing before you go to the next slide, also consider for supervisors and supervisees that you're working at your level. So say, for instance, if you just finished a graduate program, that's the level of you as a clinician. And for those who work as supervisory roles, you've been providing counseling services a lot longer than a person who's just entering. So there's a difference between the two as far as those skills and development. So we have to be mindful of a supervisee's development where they are. If I'm a first year out of the profession, postmasters, then I'm working at a certain ability of what I have at the time. And more of that development comes from actual experience in the field. One analogy that I love related to the counseling profession is the counseling profession is like the game of chess. And the game of chess, for those who don't know how to play yet, I highly recommend learning how to play, because you can learn how to play chess in about 10, 15 minutes, but it could take you a lifetime to master. Just like the counseling profession, you can get a master's degree in 2 or 3 years, but it can take you a lifetime to master. So if I just started playing chess, as in postmasters, I'm playing at that level during that time. And for many of you who've been in the profession for years, you've been playing chess for that long. So it's not about being an expert, it's just about getting better and better every year. So being able to meet the clients where they are, meet the supervisees where they are, and thinking about playing chess. They're playing at their level. So you can't expect them to be on your level when they just started playing.
All right.
You're getting a lot of props for that chess analogy, Jason.
Yeah, that was on point, man. That was on point. All right, so when in talking about diversity and culture, ethnicity, and different identities that occur, the foundation of what we have are called our multicultural and social justice counseling competencies. And it's a framework to implement multicultural and social justice competencies into the counseling theories, practices, and research. And so what that does is it allows us to build a strong supervisory relationship. And so when you sit down first with your supervisee and you're excited, they're excited, and the first thing you want to do is have that strong relationship. Just like the counseling relationship, your relationship with your supervisee is what's going to be that avenue for their growth. If you and your supervisee don't vibe in the beginning, that's why I love having that interview that we're talking about that in the chat box. If you don't vibe, there's no way that relationship is going to work. Your supervisee is not going to trust you. And once you don't have that trust, there's no way they're going to be able to learn from you. Also, in our profession and with all human services professions, we have to be aware of how important racial and cultural dimensions are in clinical supervision. I know we're talking about what if you can't work with this population. If you're coming into this with your own biases against a population and you can't work with them, you have to be aware of your own stuff and B, how important that person's racial identity, their ethnic identity, their gender identity is important for them, because those things will all come up in the relationship. And that's going to also color how they work with their client. And so we have to be able to, look at those things and say, this is important for my supervisee. Let's talk about how they may impact our relationship, and then how it's going to impact the supervisee and client relationship. Then we're looking at the cultural dynamics of graduate programs and students and faculty. What we're seeing in our programs, slowly but surely, more and more people of color coming to the counseling profession. And like Matt said, our program is very white. We come from a white institution. And if you go to things like ACA and ACEs, you'll still see a lot of white professionals and students. But in my experience, just anecdotal experience, in some of my circles, I'm seeing more and more Black men, more and more Latin men, Asian men, queer men of color, trans folks come into the profession, and then wanting to come into the profession. And so we have to be prepared for this influx of students of color, because we're still seeing that most supervisors are still white and women. So how do we equip them with the tools to deal with supervisees that are racially and culturally different from them? How do we train our counselor educators for a profession whose demographics is mirroring the demographics of our nation? Our nation is also becoming more and more ethnically and racially diverse, and so is our profession. How do we make sure that our counselor educators and supervisors, who may still be mostly white, deal with this population that's coming into the profession? And then how do we train the ones in the profession to deal with the changing demographics of our country? And so having this cultural foundation that is based in the ethics that Matthew talked about, and then having that supervisor foundation that Jason was talking about, and then adding on that extra layer of talking about culture in the beginning, broaching, that's going to be that avenue for us to have that parallel process as we are supervisors dealing with our own stuff and being aware of our own cultural identity, and then bringing that to the forefront of the relationship and helping our supervisees to look at themselves as a cultural being and how culture impacts our relationship, and then giving them the tools to bring that into their relationship with their clients. Anything you want to add to that before I go to the next slide? I know I'm talking really fast.
I would just add how everything you're talking about right now is, so important in students' clinical experiences. Like I see that in field placement. Very often, the supervisors are, of maybe a majority culture, right? Very often white, or if you have students of color, they're often going to have a supervisor of a different race, or ethnicity than them, and that I don't think that those conversations are being had in those supervisor-intern relationships enough. I know I've had some experience of students talking with me about personality issues with their supervisor, but I've often wondered if the racial differences is the underlying factor, and just the personality trait is the scapegoat.
And that's a good point, because what needs to happen is to have that conversation in the beginning, because going to that first point, to build that strong relationship, the supervisor has to be competent and culturally responsive. And so if you have the conversation in the beginning, you can talk about, all right, so how do you feel with me being your supervisor? And another comment that just came through from Dr. McCullough is the power differential, and an intern may not want to have that conversation. And so the impetus is on us to initiate that as a supervisor because of that power differential. And what that does is, I don't believe in safe spaces. Safe spaces don't exist. what I do with my supervisees and my clients and with my students is I want to create a brave space. And what a brave space is, it allows you to be your authentic self because you have the courage to do so. And then it allows your supervisee to have the courage to bring their full self into the room. And also, safe spaces tend to shut down uncomfortable conversations. So if you're looking about concepts like white fragility and white tears, when race is brought up in a difficult conversation, a lot of times a person that has privilege and is in power, all they have to do is say, I feel uncomfortable, and that stops the conversation because we don't want people to feel uncomfortable. I say with a brave space, yes, you may feel uncomfortable, but you have the courage to sit in that discomfort, and you have the courage to have the conversation and not sink back into your fragility and your desire to not have the conversation. And so in that brave space, that helps to levy that power differential. You know, that helps to everybody have the courage to say, wait a minute, let's talk about this. Even though it's difficult for me to talk about it, it's difficult for me to hear it, we still have that conversation. And that's how you deal with those cultural dynamics in the beginning so they don't come back and bite you in the ass in the end. But you have to be able to create that brave space in the beginning. Say, hey, I see you. Let's talk about this.
Also, also in addition, I think it's important, you know, for supervisees, if you are working with someone of a different race than you, like to have that conversation instead of ignoring, like it's not there, because it is. It's in plain sight. We see it. And if, as a supervisor, if I feel uncomfortable as a supervisor of broaching this conversation, that says a lot about myself of some work that I need to do. What makes it difficult for me to have this tough conversation with my supervisee? Because if you think about us in the counseling setting when working with your clients, there shouldn't be any topic that we shy away from or uncomfortable talking about, because that client may need us to talk about some really uncomfortable things that's not uncomfortable for them, but it may be uncomfortable for you. So the same rules apply when it comes to being a supervisor of no stone can be unturned. If you want to talk about it, we'll talk about it. And for me, I don't shy away. You can tell what I look like, but I don't mind talking about it. I am a Black man with a Black male perspective. So, and that perspective is my perspective. I don't represent all Black men. I'm not like all Black men. So let's talk about it. You know, you're a white woman, you're a Black man, you know, we're this, you're that. Like, you're identifying, and I'm making that aware. Let's talk about it. And is this going to be a good fit? And will this get into the way of us working together? Because some supervisees, even though I'm a supervisor, may have an issue with me being a Black man in authority with the degree or education or whatever. Let's talk about it. And if that's an issue, can we work through it? And to me, as supervisors, if that supervisee doesn't open the door, it's our responsibility to open that door and talk about it. It may not feel good at all, but you're addressing it and you're making it aware. It's not going unnoticed that there are some differences and we can talk about them.
And to piggyback on that, I mean, and like a lot of times, I know that my presence as a queer Black man will make people uncomfortable. I know that, and I relish in that. I'm like, okay, let's talk about that. Your discomfort with me. And so I think Dr. Brandt said this. We could use a lot of tools in supervision that we can't use in counseling. So with my supervisors, my supervisees, I'm laying all my chips out on the table. Look, this is who I am. Let's talk about how this is going to go. Do you have any issue with me as your supervisor? Because this is what I bring to the table. This is my lens. You know, when I was a student, a counseling student, and this is not against my counseling training, because I had really good counseling training, but one thing we were taught as counselors in training is that you leave your biases at the door. And as I've developed, I said, you know what? That is a crock of bullshit, because my biases are they're a result of my experiences. They come in with me. Now, what I cannot do is allow my biases to impede my relationship with my client. And so when I tell my students, You do not leave your judgments or your biases at the door. They come in with you, but you have to be aware of them so they do not impede your relationship with your client. And so I bring me into the room. I bring my Southern Baptist, queer as fuck, black as fuck self into the room. All that comes to the room, and some other things too, because I have disabilities that you cannot see. I have other preconceived notions. All that comes to the room, and so the brave space is what allows me to bring all that into the room. And so I say for my supervisee, look, this is your time. Yes, you pay me for your time, or you're assigned to me as my student and my counseling student, but this is your time. I'm bringing my full self into the room, and you have the courage to bring your full self into the room too. As my grandma would say, be who you is. And that's exactly what I'm expecting of my supervisee. And so when I do it, when my supervisee sees that, they can mirror that with their clients. My supervisee is going to bring their full self to the room as a counselor. And so their client's going to say, you know what? I'm going to be full me too.
Can I comment on that, David? You're making fantastic points, and just to support that, I suspect that a lot of supervisors don't broach this topic with their supervisees because they have an assumption that there is going to be a problem. If I bring up the fact that you're a different race than me, or if I bring up the fact that you're a different gender or age or sexual orientation than I am, then that's automatically going to be a problem. I think that assumption is what creates the discomfort, or contributes to this discomfort at least. So I think that we should kind of check that presupposition, that there's always going to be a problem when you bring these things up, because it's simply not true that 100% of the time that you bring up cultural differences or cultural observations, that it's going to be a problem. In fact, the point of it is to lead to good things, right? And to address these things so we can both grow personally, professionally together. And by doing so, you're modeling for the supervisee how to do it with the client. If you're not breaching the conversation, if you're uncomfortable talking about these things with your supervisee, then it's likely that your supervisee will be uncomfortable talking about it with their client. So I think that assumption is a barrier, and it's not true.
And so Dr. Sam asked the question, so how do you think we can do that with students who struggle with this in their field placement? She says she finds students have difficulty with this because of the evaluative nature of field placement and faculty supervision.
I think that's a big problem, because you see some spectrum of competence or professional identity within master's students. It's usually a small spectrum, but sometimes you have students that, hey, they're made for this. They can be licensed today. They're great. And other times, maybe a student really just needs that nurturance, the extra professional development. So they may not have the confidence to broach this kind of subject with their supervisor, or even bring it up in an internship course. So I think that's where the onus is on the dual supervisor, the professor of the internship course, to raise these types of questions to everyone, in the classroom, and assist the students with ways to talk about those things. It's really self-advocacy is what you're also teaching the students too, is how to advocate for yourself. If you feel like there's an issue between you and the supervisor, or if there's a cultural barrier, to advocate for yourself, to have your thoughts and your feelings known and your needs met. So that's not a one-time conversation. It's not an instant cure, quick fix, but maybe over the course of the semester, the internship professor can educate the student about those things, monitor their progress with those things, and kind of nurture along the way. And even go so far as to talk with the supervisor and not just the supervisee, the student.
And in addition to that, I don't know if you all know, but Matt Tirrell is like the field placement guru. He is the field placement coordinator at Monmouth University. He's an expert. I'm going to give you credit. Yes, you are an expert in field placement. And what I've noticed is, for me as a faculty member serving with practicum and internship class, a lot of times me and Matt would have to collaborate to work with students during their internship site. So they're getting supervision from their internship site, the field placement coordinator, and their professor. And it's like this triad, we all come together. And a lot of times when me and Matt put these meetings together, we're challenging those students to consider their own beliefs and biases about certain populations or groups or sites. And we encourage them, becoming more self-aware of being comfortable, being uncomfortable, being in those spaces and working through being uncomfortable with being in those spaces. Also, what I've noticed a lot of times with supervisees or, counselors in training is the population or fear that you have the most about a certain group is the fear that attracts to you. It's called counseling karma. So whatever group you don't want to work with or don't like, they're going to find you and you can't do anything about it. And when those students are, having difficulties at the site, when me and Matt put them together, we talk to them together, we notice what happens. And a lot of times what happens is they're not advocating for themselves. They have a lot of fears and a lot of insecurities of working with a group, and they don't have the knowledge. Or for them, it's like, I don't know what I'm doing. And for us, it's like, work through not knowing what you're doing. You'll figure it out as you go. It doesn't have to be perfect, but you'll figure it out as you go.
And the original comment that spurred this part of the conversation about field placement, I believe it was Dr. Sapp, mentioned, students may be hesitant to bring these things up because of the evaluative nature, of field placement. I would argue with the student that they'd get a higher evaluation if they showed self-advocacy skills or just showed the willingness to work with you as the professor to develop the skills and maybe try to implement those skills in the counseling setting, in the agency setting at the site with the supervisor. And part of that education to the student and empowerment to the student really is to help them understand that internship, field placements are a learning experience. All of the master's program is a learning experience, but it's to get to the next step, which is licensure, practicing in the field and such. And you're very likely to have a boss, right? You're very likely to maybe work at a community agency or in a school or a hospital or setting that has a supervisor or a director. So if you can learn during the learning period, which is internship, field placement, how to have those kinds of conversations and self-advocate towards your supervisor, then you'll be that much more equipped, and prepared and apt to broach these subjects with your real life supervisor when you're employed.
Awesome. Thank you, guys. All right, so as you think about the supervision process, there's like a stepwise process. And so the very first step is developing your self-awareness as a counselor. So my job as a supervisor is that my supervisees, improve their self-awareness, and then how that integrates into their own professional identity and the clear definition of their role as a counselor. I tell my students, you can learn every single theory there is, every single intervention, but the main thing is, how do you integrate your own personality into your work? You have to bring authenticity to the work that you're doing as a counselor. And so you got to bring yourself into that relationship, and your clients will know that you're being inauthentic. And so you have to figure out how to integrate your personality into your counselor persona. And what that does is that allows them to be themselves, and they're open to learning more. They're learning more advanced case conceptualization skills, because they're able to then, if they're true to themselves, they can really conceptualize what's going on with their client. There's one quote that I had in one of my classes, and to know others is to know yourself. And so you have to know yourself before you can know anybody else. If you have done the work and you still continue to do the work on yourself, then it allows you to be able to conceptualize your client and on all fronts. Then you can sit and work empathically and therapeutically with your client. Once you have that comfort in who you are and you're able to really look at your client for who they are, then you can build an empathic bridge. But that comes from having that authenticity with yourself and with your client. And then, I often tell my students, you know, I'm a Virgo, and we Virgos can be inflexible. We like the plan. We like things to go our way, and if it doesn't go our way, we get stressed out. We're dichotomous thinkers. But as a counselor, you have to temper that perfectionism that y'all been talking about, and have that flexibility in your approach. Maybe, okay, like if I'm coming from a cognitive behavioral standpoint, and the perfectionist in me wants to make sure that I'm implementing this in the way that I learned it. Well, as a counselor, and knowing that you are different from the next person that also may use CBT, and your clients are different people, you have to implement it in a way that therapeutically and empathically looks at this client as a different person, still coming from that CBT lens, but using interventions that fit this client that may not fit another client. All the while making sure that you're adhering to those ethical codes that Matthew was talking about, having that autonomy of action within ethical principles, knowing that, hey, as a counselor, I'm going to do my best, and I'm going to make sure that I'm going to adhere to my ethical principles, but within those principles, I have some latitude as to how I implement my interventions. And this process itself is a lifelong process, like what Dr. Branch was saying. This process of evaluating myself, evaluating my work with my clients, and evaluating work as a supervisor is a lifelong process. And so I have to go back into that and hold myself accountable for my own professional and personal development, and then hold my supervisors accountable for their personal and professional development. Anything I want to add to that?
Just a very live, in the moment, here and now, present observation is that that's what we're doing right now. Like, anyone participating in this workshop right now, in this presentation, that's a step in the self-evaluation, reminding ourselves of the importance of these topics that we're talking about. So I think that's kudos to anyone on this presentation, because this is part of what needs to be done.
Mm-hmm. Yes. And so, you know, this diagram, our competencies, you know, a lot of times we talk about it from the counselor-client standpoint, but if you reorient your thinking with regard to our MSJCCs, how does it relate to our work as supervisors with our supervisees? And so, you know, how am I privileged as a supervisor? How am I marginalized as a supervisor? How is my supervisee privileged as a supervisee and as a counselor? And then how were they marginalized in those respects? So one thing that I do with my students, I do with my supervisees, I say, okay, in this relationship, how am I privileged? How am I oppressed? How are you privileged? How are you oppressed? And then how does that relate to your work with your client? That's a part of that whole self-awareness piece. We have to build that supervisee self-awareness. You know, who are you? What do you bring to the room? We have to create our interventions as supervisors to help them to go through that process. Yes, they do this in their program, but in those 60 hours that they earned, that still does not give them, that's just a foundation. What we're doing is we're building on that foundation and doing direct development into their own self-awareness, because we have to make sure that they're ready to go into that setting with that client. And then looking at client worldview, who is my supervisee? Have I taken the time to get to know my supervisee as a person? What is their worldview? And I break down worldview in two aspects. Worldview is how my supervisee views the world, then how my supervisee believes the world views them. And so I want to take that time to sit down and say, tell me about you. Who are you? What brings you to the counseling profession? What is your background? How, you know, help me to understand who you are, because that's going to build that firm relationship. And with the whole, going back to the brave space, you know, a lot of times I'll say to my supervisee, look, I just put all the cards on the table. Let's uncover the pink elephant in the middle of the room. I'm Black, you're white. we have cultural differences that are similar and some that are different. And I want to talk about those differences and similarities right now because they come back and bite us in the ass in the future. And I do that because I want them to know that, hey, I see you as a full person. I see what you bring into the room, but there may be something that I don't see. Help me to understand who you are. How are you doing with me as your supervisor right now? What issues could come up with us as culturally similar and different beings? Because that is going to color our time together, my interventions with my supervisor, and that's also going to color their interventions with their supervisees, with their clients. Another thing too, and when you're looking at that outer level and advocacy, you know, when my supervisees come into the room with their own stuff, and when their clients come into with their own stuff, you know, we're always talking about, you know, I want to be an ally for my client, and I want to be an ally for my supervisee. If the supervisor is racially different from me, we have to take it a step further. Ally is good, but my question is, who told you were an ally? You know, and a lot of times when we use that ally phrase, it's thrown out a lot. Ally gives you that privilege to retreat when conversations get difficult. I want to build a relationship with my supervisee so they know that I'm not your ally, I'm going to be your accomplice. And so when stuff gets hard for you, I'm not going to retreat, I'm going to be there with you. I'm going to stand beside you when things get hard to be your support. I'm going to stand in front of you so nothing can harm you. And if things really get hard, I'm going to go check the motherfuckers making things hard for you. I do that because that's part of the development from ally to accomplice that we have with our supervisees, because I'm here to advocate for and with you, and teach you to advocate for yourself. And then in turn, you advocate with and for your clients. So you bring that same personality, that same emphasis, that same passion that you have in your relationship that they'll have with their clients. And so at the very foundation, that is how we become that culturally sensitive, culturally humble supervisor. Another thing is we have to get out of this notion of cultural competence. You know, we talk about cultural competence like it's an end result. Like once I go through my program, I have that one multicultural course. My multicultural professor was Black, so you know I'm going to be good. You know, my supervisor, we talk about culture, and then I can go out and change the world and work with everybody and be good at it. No, cultural competence gives you that notion that once I'm done and I get my license, I'm good. It's an ongoing process. Thank you, Dr. Sapp, for that. It's an ongoing process. You know, it's a process that makes us more culturally sensitive and culturally inclusive. Competence never happens, but we are striving towards this goal of making sure that we are able to sit down with whatever client, like Dr. Branch said, and sit down and have that difficult conversation with them and be able to say, all right, I see you, I can work with you. Even though I may have these beliefs that this person's identity may go against my strongly held beliefs, I can say, you know what? I may not believe in interracial marriages, but I have this client here who's a product of one, and I'm still going to work with them because I want to make sure that they're physically and emotionally well. I may believe that all gays are going to hell, but I'm going to sit with this client still and work with them. You know, I can't let my own beliefs, my own worldview, my own prejudices, my own biases come into the room with me and infect my work with my client or my supervisee, because that is going to ruin that supervisee and their ability to become a competent counselor. Any questions? Any you want to add to that?
Mic drop.
Yeah. I don't want to get in the way of anything you're saying. Keep going, keep going.
And I say this because, you know, from my time as a supervisee and a supervisor, you know, we are responsible for our supervisees' development. And as Dr. Brent said, we are indirectly responsible for our supervisees' clients. And so I have to model that. I have to show, you know, I have cultural blind spots. And I have to let my supervisor know, hey, I don't get it right. My supervisor may be another queer Black man. That doesn't mean that we're both the same. And I have to let them know that, hey, yes, we have the same cultural identity, but there may be some in-group differences. And that's something that we have to let our supervisors know when they have their clients that are culturally similar to them. Yeah, you may have the same look, you both may be Black and same gender or whatever, but there's still some differences that come into the room too. So we have to talk about the similarities and differences as well. And so we touched on this a lot. Anything y'all want to add, Dr. Branch, Dr. Sanabria, Matt, to this?
I have no words. I knew, I just knew what was coming. I have no words. Thank you for all of that.
No problem. Okay, so we talked about that managing that cultural relationship and how we have that relationship with our supervisor and supervisee to client, but we cannot forget that supervisor and client, that indirect relationship, and how the tools that we use with our supervisee are the ones that they will also be using with their clients. So as a supervisor, we are managing not only our own cultural inclusion, but the cultural inclusivity of our supervisee. The work of normative violence is kind of provided that foundation for cultural broaching, and it's a counselor's ability to consider the relationship of racial and cultural factors to the client's presenting problem, especially because these issues might otherwise remain unexamined during the counseling process. And so all it is our ability to sit down and have that difficult conversation in the beginning. We have to have that sit down, come to Jesus meeting, let's uncover the pink elephant in the middle of the room and set the foundation. And one thing that, you know, the work with normative violence, and actually she just revisited this and created a scale for cultural broaching. One thing that she found is that a lot of times white counselors in training have more difficulty in broaching culture than counselors in training of color. And so what we have to do as supervisors, when you have supervisees that are reticent to have these cultural conversations, we have to like uncover the pink elephant in the middle of the room and think about the difficulty that they may have because of their own background. You know, a lot of times as people of color, we have to talk about race. It's at the forefront of who we are. And, you know, our white counselors in training, because white privilege don't have to have that emphasis. And so we have to work through that and help them to talk about the discomfort that they have talking about race. And then be that model for them and say, hey, you know, yeah, I know that's difficult for you. Let's have the conversation and practice ways that you can do this as a white counselor in training with your client who may be culturally different. I think Matt spoke to this as well. You know, our students are mainly white, but the outside community does not mirror that. And so they have to be comfortable in having that conversation and broaching culture with those clients that are racially different than they are.
I'm going to attempt to say something while David is saying something. All those points you're making, David, really just are so on point, and they reaffirm how I believe anyway, that white fragility gets in the way of the white counselors in training from broaching the concept of race and other cultural issues. But the privilege of being white allows our blind spots to persist, right? So I think that's a big chore, or a task of supervisors and our counselor educators to help master's level students and counselors in training to be able to understand their own culture, what white means, or what male means, all positions of power, right? Positions of privilege, what they mean and how they really exude and play out in their lives, because they may be so unaware. But I think that lack of awareness can't be an excuse. And we can't just let the clients or supervisees or students of color to educate, people, like white people. So it's not the onus on them to educate us. We need to be able to help students broach these conversations, introspect for themselves about their own culture, how it plays out, and not use the power and privilege as an excuse to stay blind.
Yeah, you bring a really good point about, we have to do our own work. Even as supervisors, our white supervisors have to do their own work too, so that they're comfortable having those conversations with their Black supervisees, or their other supervisees of color. So we as supervisors, like Dr. Brandt said, may not have done our work either. So we have to be comfortable in having those conversations and bringing that to the forefront in the supervisory relationship, mainly because your supervisee can leave their relationship saying that my supervisor really did not see me.
Sorry.
Go ahead, Matt.
Yeah, and just, we don't have these conversations with our students or supervisees in a shaming way. It's not a gotcha moment of, hey, you're saying a racist comment there, or hey, you're not being culturally responsive to that client of yours. It's not shaming, it's their learning moments, right? Because most of us haven't had to introspect about our own race. Most of the time, people in power or people of privilege don't have to have that assessment. They're maybe just so unaware. So we have empathy with people who haven't had to go through that process, who are very low in the their stage of development, of racial identity development. So we had to have empathy for that, the fact they haven't had to do that, but we broach those subjects so that they can start to do that. And we see that play out in the master's programs, where the light bulbs start to turn on, but we don't do it in a shaming way or a blaming way or in a gotcha way. It's a, hey, let's grow, right?
Yeah. And Jamie makes a really good point. Thank you, Jamie, for that. Creating foundational similarities can dispel the weight of the differences. And so, yeah, talking about the similarities and differences is going to be important. And one thing that Matt said when we were talking about the presentation is that difference doesn't mean bad either. So looking at similarities can help to mitigate the differences, and also reframing our differences as the beauty of our relationship. And so Dr. Devine talks about 5 different types of broaching, and I'm gonna read all of this, but as you develop as a counselor and as a supervisor, there's like a developmental model that goes into broachings, and at the very beginning, we could be avoidant, but working towards infusing it, making sure that broaching is throughout the whole entire relationship, not just at the beginning, but putting culture at the forefront and throughout the whole relationship is going to be important. So having that infusing type, making sure that we are talking about socio-political issues that happen. If you think about Brockenbrenner's model, what's happening in the microsystem that's going to impact the microsystem that's happening right now. Like, if my supervisee is of Muslim descent and is from an Arab country, we need to talk about what may be happening on the news that may be impacting their relationship, our relationship right now, because that can also impact their work with their client. So that if they have a client who's culturally different and something is happening in the macro system, then they can bring it to the forefront and say, hey, I noticed this happened, and I want to give some time in our time together, and we can talk about that and see if that may be impacting you right now. That may have nothing to do with their presenting concern, but that may also impact your time at the moment. So bringing that into the here and now is going to be important too, but you have to be aware of those things and infuse that into the relationship. Any other comments before we move on? All right, Dr. Sanabria, it's on you, my friend.
All right. Okay. So first of all, I want to thank you, David, because somebody like myself who struggles with ADD and finds it very hard to sit down in the same chair for 3 hours, your power and energy is welcome. So thank you so much for that. And thank you for speaking your truth, for sure. I want to now go into and talk about the multicultural orientation model, which is really a framework that is, as far as our developmental process in furthering our understanding of multicultural issues, is this fairly new concept in our field. It was originally developed by Owen and his colleagues as they were analyzing and critically analyzing this idea of being a multiculturally competent therapist, right? And we've already mentioned that there really is no such thing as competence, because again, it insinuates that we have reached a certain point, and that's it. We've done growing and learning during that process. But in further analyzing the competencies, they realized that there is a difference between competence and orientation, right? It was if you think about our theories class, I don't know how you teach it, but I'm actually teaching it this semester, where we're learning about all these different theories, and in the class and at the end of the program, we ask our students to develop their own theoretical orientation, right? And I have this conversation with them. There's a lot of anxiety. It's like, oh my gosh, and what I hear from students a lot is like, I can't really conceptualize my orientation because, you know, I'm really interested in Gestalt theory, but I don't feel competent in it. And it's great. I'm so glad that they say that, because you know, that leads to a conversation about how there is a difference between competence and orientation. And this is something that Owen and his colleagues have discovered as well. Competence is, again, looking at things that you can do in order to be effective. And orientation is the way that you understand things, the way that you conceptualize your clients, the way that you understand how the world works and functions, and how therapy works, right? You can have an orientation, but not have competence, okay? But we keep talking about competence, and, you know, ever since I have gone through my training back in the early 90s, that was the discussion that we were having. The learning is, oh, you have to develop these competence, right? So this model that was, or this framework that was developed was inspired by another theory or understanding about the importance of the therapeutic relationship that was developed by Norcross, that looked at 3 areas of the therapeutic relationship. One is the establishment of empathy, right? Having an empathetic relationship. Also having a working alliance with our clients, meaning that both the clinician and the client have shared values, shared goals that they would like to work through. And the last one is a real relationship, meaning that there is a genuineness in the therapeutic relationship. There's congruence, there's an understanding, there is a rapport that is developed, right? And so that is not really addressed in the competencies, okay? So Owen and his colleagues went ahead and looked at how we can add to our understanding of all the aspects of the multicultural work that we do. And so they developed this model. If you can go on to the next slide. It's a process-oriented model as opposed to a content-oriented model. Competencies looks at training and training standards. The orientation really looks at our understanding of our work, okay? It's a way of being, okay? And so from there, we're having this conversation about how we can develop this understanding and this worldview and infuse it with our work with our clients. This translates with our work with supervisees as well. I mean, I know and I'm aware that I keep referring to the relationship between the clinician and the client, but this goes with the supervisor and supervisee as well. The supervisor needs to have a multicultural awareness as well as a supervisee, and it encouraged that development in their own work with their clients, okay? And David, go ahead and go to the next slide. So we know what we mean by the multicultural orientation, because it has 3 constructs that we're working with in the development of this orientation. The first construct really is the overarching value and virtue of this orientation, and that is humility. Okay, it is what we come into with the relationship. That is first and foremost. It's a way of being. It's a way of striving, right? Of taking the back seat and allowing the supervisee or the client to bring in or to learn from them, actually, and through their own understanding of the world. It's a thriving towards the other 2 constructs, which is looking for opportunities and thriving to develop a level of comfort, right? Go up one more slide. So with cultural humility, again, this is an ongoing process, an ongoing self-reflection. It is also requires the supervisor, supervisee, clinician to be other-oriented, right? Not to be thinking that you are the expert and that your understanding of these different identities and or that you have an understanding of their experiences regardless of their identity. I have to say that oftentimes I struggle in having these types of conversations, because when we talk about cultural identity, it's as if there is one solid identity and values that are in there when we know that it's so diverse, and it really doesn't take into consideration the intersectionality of all these identities. If you look at right, you're feeling that. Good, okay. And you look at the competencies too, that when look and read through the competencies, you'll see that it is very oriented, and this is one of the criticisms, it's very oriented to a single identity model, right? So it's so difficult, but what I love about cultural humility is that when we are other oriented, we're taking a step back and saying, I don't presume to know what your cultural identity is or what your cultural experience is, because I know that you are an individual that is processing your experience, your societal experiences based on your identity your own way, right? So to me, it's just, I love this idea of cultural humility, of just taking a step back and really being other oriented.
Sam, could I say something about that?
Yeah, absolutely.
So what you're speaking to just reminds me so vividly of a concept that I learned and just heard, even just one sentence that I heard in my intro course 10 years ago, of every interaction with a client is a multicultural interaction.
Mm-hmm.
And we've seen in the comments how we don't represent an entire population if we have a specific, characteristic or, a certain identity, gay, black, female, male, any of these things we're not just those one thing. So every client we see, every supervisee we meet with has their own unique personal culture. So every interaction is a multicultural interaction. So that speaks to the ongoing process and the openness and the curiosity. That definitely opened my mind at the time. When I heard that statement. It opened my mind and just kept me continuously curious about the individual sitting in front of me.
Yeah, absolutely. Thank you. And I think of an example that I've had with a supervisee who was talking about a client that they were working with. And the client had a lot of dominant identities. But the client said, oh, the supervisee said during supervision, oh, the client is from, I forget what state, Tennessee. And I remember saying, wow, Tennessee, I wonder what his experience is like living here in Central Florida, being born and raised in Tennessee. And here was an opportunity to learn about that specific client's experience and identity. And I mean, that is a cultural difference, if we're looking at regions. And so, that was an opportunity right there. Actually, which goes on to my next slide. Which is looking at, cultural opportunities, cultural courage. Now, I mentioned that humility is the overarching value and virtue. It's just a value that we have. When we look at opportunities or cultural courage, it's really more of the behavioral representation of humility. It's now moving into looking for opportunities to broach the topic of culture, to bring it into the room. Yeah. And, for example, with the example that I gave with the client from Tennessee, that was a perfect opportunity for my supervisee to bring that experience into the room with their client and get to know their client a little bit better, and actually have the client feel validated for their own experiences. Yeah. So again, this is more of a behavioral representation, is to look for opportunities to engage in conversation, to recognize that there are, that culture does influence the dynamics, the counseling relationship. So being open to those experiences, and this actually also really requires the supervisee, the clinician, to be present at all times with their client. Because if you are looking for these opportunities, you really have to be there and engage and present with the client. So, so that's important. And then the last.
Sam, can I just say something? I'm sorry, before we go to the next slide. I just really like your examples of like things that someone can say as a supervisor. You know, let's explore this. This sounds important to you. Sounds difficult. Let's talk about it. I think sometimes supervisors don't broach these types of subjects, especially newer supervisors and even counselors in training with their clients, not knowing what to say. How to bring it up. And it's so valuable to be able to put actual words to this. So I just valued and appreciated some of your prompts there as good examples of how to take those cultural opportunities.
Yeah, absolutely. And again, we don't have to be, when we're open to these opportunities, we see that we don't really have to just specifically look at more of the more obvious identities like race and ethnicity. It's like, oh, I need to look for those opportunities, but simple ones that you notice that come up, that the client brings up into the session, can lead to broader areas of their experiences or lead into other types of identities and experiences. Yeah, so just being open, just like looking for those opportunities. Yeah, but thank you.
In addition to that, especially with the wordplay, I think for a lot of supervisees, as a supervisor, your supervisee looks up to you as the supervisor because you have experience. You're that just the different layers. Your authority figure. So even with practicing this as a supervisor to that supervisee, the supervisee is able to take that information and use it with their clients. Where my supervisor brought this up to my attention, I didn't think about it. We talked about this, and now I can use that skill or that tool to work with my client. So you're constantly doing supervision, even when you're trying to have those conversations or broach, areas. Your supervisee is learning from that, and they're going to use it too. And for example, when I was doing supervision eons ago, I still remember some of the things that my supervisor told me, and I still use those things that she told me. And it's just, you make a huge impact on your supervisees based off of what goes on in that session.
Right. Awesome. Thank you. Yeah. As I'm sitting here listening to the first part of the presentation, so much of what I'm saying now has been expressed and said by you, Jason, but Matt and David and other people in chat rooms as well. But it all goes so well together, and I'm so glad that we are having this conversation and that we are looking at these different models so that we can bring it together to have a broader understanding. Because when we talk about broaching, we're really talking about these opportunities and the courage to do so. But again, we may be looking at it from a different perspective with this particular framework. And with that too, it's that it's a continuous conversation that you're having with your client and your supervisee. It's not just a one-time, let me touch base with you. Are we good? Are we good? We've had that conversation. We're fine. Okay, let's move on to something else. It is understanding that this is so embedded in every type of relationship we have. Actually, to be honest, I love this multicultural orientation discussion to have just on a personal level. I tell my students, listen, yes, this is important to have to explore and to develop as a professional, but let's talk about how this could be an advantage to you in your personal life. How can this enrich your life and your relationships outside of the therapeutic relationship in your world? This you should embody in all aspects of your life, not just your professional life, but your personal life as well. You'll see the world so much more beautiful. The last one, David, if you don't mind going to the last slide, is comfort. Having cultural comfort and being, excuse me, having these conversations without with the approach of allowing yourself to learning. I mean, that's what humility and looking for opportunities is about, but without being reactive when you encounter a belief or an idea or have an experience that it challenges you a little bit, right? And to really approach it with openness and understanding. I had a faculty meeting, because every Thursday we have a faculty meeting, and we were talking about our experiences with our students centered around a multicultural interactions, right? And one of our faculty brought up how important and how glad she was that we were having this conversation, because as we were talking, she was feeling very uncomfortable as a white person. When we were talking about racial issues and experiences that we have with our students of color, she was sitting there listening the whole time, feeling very uncomfortable. And at the end, she said, "I'm so glad that we had this conversation, that this was brought up in the faculty meeting, because I was made aware of my discomfort and I was being challenged. I had certain ideas and you all were bringing things up that challenged my ideas, and I need to go and do something about this now. I need to examine why I was feeling uncomfortable or this discomfort, right?" And this is something that we need to be aware of and to strive for when we develop our humility, is to be more and more comfortable and to be open to different perspectives and different ideas. I love the conversation that we had earlier about, the importance of similarities as building rapport, but not doing so in a way that takes away from the importance of these differences and embracing, because that's where the similarities are awesome, but it's the differences that allow us to learn and grow as clinicians, as supervisees, supervisors. So just being open to learning about that. So that's what I want to say about the multicultural orientation. We are at 4:30. David, I don't know what room we have for conversations. I know the next slide, we're opening it to the rest of the attendees.
And so, yeah, so what was your pro from today's experience? How you integrate what you learned into clinical supervision? Tremaine just posted a question in the chat box. In your supervision experiences, does anyone get the sense that utilizing a particular supervision model facilitates multicultural conversations more effectively? I tend to, use a developmental model, Janine Bernard's developmental model, and in the beginning, when I am the actual in the teacher role and providing instruction, I utilize that power differential to bring that multicultural conversation into play. But I'm also modeling that for my my supervisees so that they can in turn do that with their clients. And so I utilize that developmental piece and where I'm the instructor and viewed as like the person in power before I end up being the consultant in the relationship where, I'm there as like, a partner in some respects. As an instructor, I'm giving that instruction and talking about culture, bringing to the forefront as a supervisor. Anyone else want to add?
David, let me just jump in here for a second. This is Lori Ann. I'm sorry, a little logistic thing I would need to make sure we take care of. And that is, I want to make sure everybody's full name is in the participants list or on your video feed, because we cannot give you continuing ed credit if we don't see that you've been in the session the whole time. So I notice there's still a lot of people with first initial, last name, or just first name. And I need you to fix that by clicking rename over your name or on your video. And then other than that, I just think you guys are awesome. This is wonderful. Keep going.
Thank you.
But to complement what David was just saying about, looking at it from the developmental model, part of that is understanding where your supervisee is developmentally from their multicultural, lens. So do they have, multicultural sensitivities, and are they being multiculturally responsive, to their clients and such, and being able to integrate, lessons that brings them to the next level of multicultural awareness, when they're at that stage.
I'm going to say I love what we just talked about today. This is a great framework to incorporate in your supervision.
Sam, regarding the multicultural orientation model you discussed, I just wanted to put out to everyone, I would suspect that it would be really hard, if not impossible, to get to the cultural comfort stage without going through the cultural opportunity stage and the cultural humility as the foundation. As you said, cultural humility is the foundation for it all. It's so important to have that as a basis, because when you're culturally humble, you're inquisitive, you are curious, and you're aware of those moments, learning moments, and you're present with your client or your supervisee, and you notice those things. So you take those cultural opportunities, right? Those moments, those brave moments, cultural courage moments. And I think that the more that you do that, the more you take those moments and those opportunities, leads to more comfort with it over time.
Right, absolutely. Yeah, thank you.
So we're curious. We want to hear from you all. What did you gain from this experience? We talked a lot. We gave y'all a whole lot. So we want to hear, what did you get from this, and what can you use from this presentation for you as a supervisor or even a supervisee?
And you can use the chat box, or you can just unmute yourself and let us know. We want to engage you all more in conversation too.
Mm-hmm.
For me, this reinforces the importance of being able to have open, real, honest conversations that allow your supervisees to look at themselves, but also as a supervisor to look at yourself and identify ways in which you are helping to facilitate growth, and ways in which you really might not be doing that and correcting those issues that may be there.
Thanks, Dr. Rush-Wilson.
Welcome.
That's that level of personal accountability you're referring to, which I think is so important.
Well, building on that, what Dr. Rush-Wilson was saying is, I really appreciated your discussion of accountability, that we're role modeling, that if we can't do it, we can't expect our supervisees to do it, or our clients. And I think that's really important and cannot be said enough, is that responsibility we have to be the leaders and to demonstrate what needs to happen.
Thanks, Dr. L.A. Maria, I saw you as well.
Oh, there's so much that I absolutely love. It makes me, I feel like it's energizing to have these conversations, but also what I think has been so incredibly wonderful to me is, as an educator, you have to be able to explain things in a variety of different ways. And so I've been able to acquire additional language to use, some of which is extremely powerful, like the word infect. When we're speaking about as far as what we bring and how that might impact our relationships with supervisees or students. Mm-hmm. It's pretty exciting stuff.
Thank you. And I'm glad you brought the language piece because a lot of times we have all the lingo, but we have to present this in a way that our supervisors can understand it.
Mm-hmm. Mm-hmm.
And they aren't always going to get the lingo, so you got to bring it to their level.
Mm-hmm.
And one thing that Matt says a lot, not only in the presentation, but it says in general, is like we have to look at our supervisors where they are developmentally. And then, they may not want to hear the lingo. They want to just shoot straight. Mm-hmm. And so give it to them in terms that they can understand it. And then that's going to be a teaching tool for them to talk to their clients. Give it to them in the way that they can talk. That's a cultural lesson right there. Learn your client's lingo and talk to them in that way, but be respectful in doing that. But give it to them in a way that they'll understand it.
Yes. Mm-hmm. Well, and being an educator myself, I have my language, I have my own experience, and I know my students there. But when you say things that are powerful, when I'm listening and it goes like, oh, that's so amazing. It helps me bring that then to the students in the classroom so that they might feel the same.
Yes. Oh,
or
yes.
have the opportunity to.
I would just want to take a moment to support the discussion that's going on in the chat about consultation, the need for it, the importance of it. Someone asked, like, do you find yourself as a supervisor continuing to seek supervision and consultation? And, yes, absolutely. I think that is a big piece of the accountability issue that has been brought up, and goes back to the idea of comfort versus discomfort that Jason was talking about. If you get too comfortable, that's not good. For me, it's a red flag. If I ever feel too comfortable, that's complacent. I rarely ever feel comfortable in any of my roles, but that's just because of the commitment to like lifelong growth and learning and striving. But if I ever do get that feeling of complacency, hey, I got this, that's a red flag. So peer consultation is really important, to consult with other counselors, with other clinicians, other supervisors is a good way to hold yourself accountable and to learn more, really,
Mm-hmm.
the way of growing yourself.
I know we have some students in the room too. We talked a lot from the supervisor's perspective, but as a supervisee, what have you gained from this and take back to the supervision relationship in the event that you want to address some things with your supervisor?
Come on, students, you're being graded on this. This is one way that we do learn, though, as educators, and supervisors, is hearing from supervisees and hearing from students,
Mm-hmm.
What their experiences are, what works, what doesn't work, what they're looking for, what needs aren't being met, their opinions. So I hope we do hear from some students today.
Please, yeah.
Someone said I have a year left in my program, but I'm hoping that I can be 100% open with my supervisor when I do have one.
So I would say, instead of hoping, expect to be open with your supervisor. And if you're working with a supervisor who you can't be open with, then it's time to get a new supervisor. We have plenty of supervisors out there. It's just finding one that's a good fit. So if that's something that's important to you, you should get your needs met to meet with someone who you can be open with.
And to add on to what Dr. Branch just said, I mean, even if you're in your program, your practicum or your internship, you still have a voice. Use it. Don't be subjected to something that's not comfortable or appropriate or that gives you the space you grow. Now, sometimes you have to work through discomfort, and you have an ACA code of ethics obligation to try to work with that person and work through the differences. But if it's really not working, you need to speak up. And, that's really important so that the rest of your team can support you as well.
Mm-hmm, mm-hmm.
We got you can go ahead. You can go ahead.
Because I think you're about to do the same thing I was about to do.
Yeah, go ahead.
Me too.
we ready. We on it.
We on it, man. Angel asks, how can students lean into approaching the supervisor despite perceptions of intimidation or strong personality? Oh my goodness. That's a good one. Okay, so first, I want to address the perceptions of strong personality and intimidation and how those can be racially charged descriptions of people. So first, let's talk about that, because and just to be transparent, a lot of times my colleagues who are Black women and are supervisors get that same feedback, and it's kind of, they get the feedback that they're rude, or they're the whole angry Black woman image comes out in evaluation. And so we have to address how sometimes those terms like intimidating and strong personality can be racially charged language, and they tend to marginalize strong women of color. And so I have to address that first. Secondly, and looking at, I have a strong personality too, so I have to, I have to realize that I can come across as like really just in your face. That's who I am. But that doesn't mean that I have to temper that in a way that my supervisee is still encouraged and able to come to me and still be authentic to who I am. And so we have to talk about those things too, knowing that, like Dr. Sapp says, that I cannot control your perception of me. And I'm going to, and my grandma said, I'm going to be who I am. What we can do is talk about your own perception and what is behind that perception of me, so that we can come to a consensus of, I'm going to be authentically me. I want you to be authentically you, and we respect each other and who we are. That doesn't mean that you can't always come to me about an issue that you're having with me or with someone else.
I would also add to that let's revisit the conversation we had just a few minutes ago about the importance of language, right? And being able to talk with our supervisees in a way that that is meaningful for them, and also meets them at their developmental stage. But everything's a learning moment, right? So being able to explore the perceived intimidation with the supervisee to kind of help them work through that perception, because that could also play out in their professional life. If they're intimidated by a certain client, if they get a job and they're intimidated by their director or their supervisor. I don't think the onus is on you to completely change your personality or anything like that, but maybe to bring it up and maybe just state your observations or things that you're inferring from what the supervisee is saying or doing or how they're behaving, to address their perceived intimidation. And that could help them work through it, and would be beneficial for them for the rest of their career.
In addition to that, thinking about, as I mentioned before, about the many hats that we wear as a supervisor or clinician in training, if I'm intimidated by this particular person for whatever reason, like, do I know this person, or is this based off of what I've heard, or this is based off of what I've observed? So being able to have a one-on-one conversation, you may get a different perspective about this person than you had from observing them. Also, if I'm intimidated or have feelings about someone with a strong personality that's in leadership, the same rules apply when it comes to my client. I could have a client who's a CEO of a Fortune 500 company. Do I feel so intimidated that I can't work with this person? So it's challenging your own beliefs, ideas, and to me, actually doing the work to change that perception into a reality. Because a lot of times we have these feelings or beliefs about people that's a perception and not a reality, because I haven't done the work. And I'm going by what people say or what I've seen, but I've never had a conversation with this person.
And being able to appropriately and empathically challenge those cognitive distortions that strong personality equals bad. Whoever said that strong personality equals bad. So let's work through your perceptions of what strong personality is and what it means to you and how you respond to it.
Mm-hmm.
Another topic came up from Jamie. My supervisor was also the director of the agency I was with. Looking back, it was a dual relationship, and I found it difficult to talk about my struggles as I was wanting to appear all together. This foundational period as a developing clinician caused challenges down the road. It's an excellent point, excellent topic to bring up, because oftentimes as clinicians in training, it's this idea that we have to be perfect and all together. It's a belief system that's been passed down for generations after generations of the stereotypical clinician. Stereotypical counselor is we don't have problems. The reality is we all have problems. Why? Because we're human. But do I allow my problems to get in the way of the work that I do? So this idea of being perfect, or having it all together is an idea and a belief. And oftentimes that's when we have the ethical violations. That's when we have the mistakes happen, because we're trying our best to be perfect when we're not. So to me, a suggestion is I'm doing the best I can with what I have, and that's more than enough because that's all I have. So this idea, especially when you're working with a supervisor, you're looking at this person in power or this position that they have where they've been playing chess a lot longer than you have. So therefore, how can we even compare or compete? And sometimes we get into that place of competing or comparing with other people, and there's no competition. The competition is you versus you, not you versus anyone else or the clinician that you're trying to become.
Yeah, Dr. Geckler just said, to be what you just said, Dr. Branch, is we often suffer from superhero syndrome with the belief that we are perfect and need to carry the weight of the world. You know what? And going back to that cultural, that self-awareness, you know, I'm aware that part of my friends are going to fuck it up at times. You know, and we have to be resolved to the fact that we are not perfect. We are not going to always get it right, and we can't be all things for all people.
The original question too about the the supervisor being their director also really speaks to the importance of being mindful of the ethical codes and trying not to engage in dual relationships. There are some negative outcomes that can come from dual relationships, and that's one of them there. I know in our counseling program, we don't allow students to have a supervisor who is a clinical supervisor for their field placement, who's also in their chain of command as like their employer or anything like that, for that exact reason. So I have sympathy or empathy, what have you, for Jamie, who went through that. And it's unfortunate that maybe someone else didn't advocate for you, intervene on your behalf. Maybe the professor could have done that, or your field placement coordinator could have done that. So at the master's level, it really is a collaborative effort. But then you also do have to gain that skill of self-advocacy and be able to say, hey, something about this doesn't feel right. I wonder if it might be better if I'm paired with so-and-so as my supervisor. So I think that's important.
I'm loving this dialogue, everybody. Anybody else? What you learned from today, how you want to integrate this into your clinical supervision, and that goes for, supervisors and supervisees.
Can you hear me?
Mm-hmm, mm-hmm.
Oh, okay, yeah. And this is really probably for another conference, another discussion, but one of the challenges that I have as a counselor educator, as a clinical supervisor, is working with with diverse students who are at different levels of their awareness and openness and humility, because when the approach that I like to take with my students is, because I understand the importance of challenging our students but there's a certain level that you can go to that if you pass, then they don't learn, they shut down. And so it's a struggle to find that space where you introduce these topics and you introduce it in a way that is at their developmental stage, because I want them to move forward in steps, that in their developmental stage, this is the range in which is challenging, and going beyond that at this moment with that student may shut them down, and so that's a really big challenge that I have as a counselor educator, and I mean, again, this requires a bigger discussion, but I just wanted to put it out there.
That sounds like you taught us about the humility as a supervisor in training, and that's just your humility you're sharing with us. So I appreciate you sharing that truth, because a lot of us deal with that, and that's our humility of we're trying our best to meet the students where they are and support them and do all this work, but sometimes there is that threshold of like, I don't know if is this too far, or the student may react to it, and we just don't know. And just being humble and authentic enough to know, like, I'm figuring it out myself, even as a faculty member, even as a supervisor. And that's just that humility, which keeps us honest, it keeps us authentic. And we're modeling that behavior. Yeah. So I think that's a great point that you brought up.
So I was typing, but I'm a terrible typer, so I'm going to stop typing and just address. I just wanted to validate Tremaine's point earlier about sometimes dual relationships are unavoidable. I just want to validate that. Certainly in different communities it is. I suppose the goal is to mitigate the duality or the closeness of the duality, because there can be a little bit of a spectrum. I worked with someone 5 years ago, but they want to be my supervisor now versus, I want to be a supervisor to my best friend, So just kind of trying to mitigate the intensity of the duality and understand like the context that the relationships are in, just to keep them as ethical as possible.
So I do want to model behavior, because that's what we've been talking about. So we got about 8 minutes left before we close out. So any, final thoughts, final questions, or anything before we close out? Okay, so
I would like to thank all. I'm sorry, Jason. I just wanted to say thank you to all of the people who wrote positive comments, just giving positive feedback without asking questions. That was very kind of you, generous of you, and it's greatly appreciated. Thank you.
So I just want to remind everybody, Caitlin, can you put the continuing ed back up in there for us?
Yes, I can.
Thank you. Sorry, you guys go ahead.
Thank you all so much for spending this time with us. We really appreciate you all. And thank you, Dr. L.A. Stretch, for giving us the opportunity.
I have enjoyed it. This has been an incredible week. I don't know how much everybody's been able to attend, but this has been an amazing conference that I think we all desperately needed right now. And so it's just nice to share the space with wonderful, amazing, talented colleagues. And I just really appreciate everybody's time and the discussions. It's been wonderful.
Thank you.
All right, that's all we have.
Thank you.
All right, David, if you don't mind sending that presentation